Hello folks, how's everybody doing? Hope you're all staying well out there. Welcome to this week's presentation, which will be online. And as you can see here, we're going to be talking about orthopedics and rheumatology, the study of the skeletal system, the joints, their functions, and diseases as such. This has always been one of my favorite Gary Larson, The Far Side cartoons regarding the boneless chicken ranch. All right, a little bit of Sixth Sense of humor. Let's get that out of the way. So to start off with, in this presentation, there is a blank slide, which if it was being projected in class, you'd be seeing a link to a video on the anatomy and physiology and general function of the musculoskeletal system. That's not presented here, but it is presented in your Blackboard folder, so please make it a point to take a look at that and learn from it. This is the video right here. However, it will not project on this media. So what are some of the functions of the skeletal system? It's a very important body function system. It has several components and it has more functions than you may think. For instance, major functions of the skeleton itself is to provide your framework, your shape, and your structure. You would not be able to survive without the framework that the sturdy bones make up. You would just be a big blob of jelly that would not be able to do anything, not be able to move, not be able to fix anything, not be able to do anything for yourself. It's also very important in the protection of organs. So it's pretty obvious. The skull is meant to protect the brain. The thoracic cavity, which consists of the spine, the sternum, the ribs, all are meant to protect the vital organs such as the heart and the lungs and the major blood vessels. Although you have to understand that these structures that are meant to protect vital organs can also cause damage to these vital organs if their integrity is disrupted. For example, if somebody gets hit really hard to the head, the protective encasing of the skull can actually become detrimental as the brain swells and it doesn't have anywhere else to swell because it's contained within the cranial cavity. So as the swelling and the inflammation continues, the brain starts swelling onto itself, which causes damage to structures and causes all sorts of events like seizures and irreversible brain damage. If several ribs are broken, because the forces have overcome their integrity, they themselves can damage the organs that they were meant to protect. They can puncture lungs, they can puncture blood vessels, and they can interfere with breathing. So your skeleton also is important for muscle attachment. There are various points on each bones where muscles are meant to attach and insert and work upon to provide as levers for movement. The skeletal system is also very important in producing blood cells, red and white blood cells. This process usually occurs in the middle cavity of the long bones, called the marrow cavities, in a process called erythropoiesis. In these bone marrow cavities, you have what's called stem cells, which are cells that are really not differentiated into doing anything specifically. And under the influence of a hormone that's secreted by the kidneys called erythropoietin, they are meant to stimulate the production of these cells. And another very important function of the skeletal system is storage of calcium. Now, you've all learned in grammar school that calcium is important for bone and muscle teeth structure and integrity. Calcium is very important for other functions as well. Your muscles would not be able to contract without the presence of calcium. Your nerve cells would not be able to conduct properly without the presence of calcium. And that calcium gets transported within the blood. Some of it is attached to proteins and some of it is free floating. And if you don't have the proper levels of calcium in your blood, you could have all sorts of problems relating to conditions called either hyper or hypocalcemia. So under the directions of certain hormones from the thyroid and the parathyroid, your blood calcium level is meant to be maintained at a certain homeostatic level. If your blood calcium level, for whatever reason, becomes too low, either through malabsorption or other illness, then your endocrine system will start taking little bits of calcium away from the skeletal system I'm talking about microscopic bits, and releasing them into the bloodstream to keep those levels up and at the appropriate levels. So now, according to your textbook, the human body contains more than 200 bones. If you want to be specific, about 206 bones. We actually have more bones in our bodies as we are newborns and small children, but over the course of growth and development, many of these bones fuse together and become one. Um, when you look at the skeleton itself, out of all these 206 bones, you can break the skeleton into two major important anatomic regions, the axial and the appendicular skeleton. The axial skeleton composes most of what's found in the middle of the skeleton, and that would be the skull, the rib cage, the spinal or vertebral column, and something called the hyoid bone, which is found in the throat, which is the only bone in the body that is not connected or articulated to any other bone. Then you have the appendicular skeleton, or if you can think of that word as appendages on the outside, which makes up the scapula or the collarbones, the humerus, the upper arm bones, the lower arm bones, the pelvic girdle, the areas of the hip bone, the femur, the tibia, fibula, ankle, feet, and bones, and so on. And you can see it represented on this diagram here. So in your axial skeleton, you have your skull, your spine, your spinal column, which is made up of 33 vertebrae, your rib cage, your sternum. You can also include the ossicles, which we'll talk about in a few minutes. Those are the bones of the inner ear, the three bones that help facilitate hearing that we talked about a couple of weeks ago. And then if you look on the right side of the diagram, or I should say the left when you're talking about anatomic position, you have the clavicles, which are the collarbones, the scapula, which are the shoulder blades, the upper extremities. The humerus is the more proximal bone of the arm, with the radius and ulna are the more distal bones of the arm. When you look at anatomic position, the radius is always on the lateral side or the outside of that position. That's exactly where you find a radial pulse, by the thumb side of the forearm. The ulna is on the medial aspect of the skeleton. And then you have what's called the pelvic girdle, these two wide flat bones called the ilium and the ischium, which makes up your pelvis which is basically a foundation of your upper body. And then the lower extremities, including the femurs, which make up your thigh bones, which are the largest and strongest bones in the body. And not represented here on this diagram would be your lower extremity bones, the tibia and the fibula, and then all the smaller bones, which make up the hands and the feet and the toes. So you have various types of bones found in the skeletal system. And so just looking at this picture, when we think of bones, we commonly think of the long bones, the bones that our little doggies run around the backyard and dig up or plant or bury in the backyard. And long bones are mostly found in the extremities. Example would be the humerus, the radius, the ulna. As you can see, they have a long shaft, a little more compact in the middle, and protruding articulations at the end called the diaphysis, where they would come into contact with other bones. So notice the interesting thing about the long bones, that they're primarily composed of a long shaft called the diaphysis, which is made of hard, as I said before, compact bones, which is very compact and very strong. The hollow space inside the diaphysis is called the medullary cavity, or the marrow cavity, and it contains yellow bone marrow. It's kind of funny that it's yellow, but it makes red blood cells. Each end of the long bone is called an epiphysis. Epiphysis is made up of spongy bone. Spongy bone is less dense than compact bone. It's more of a scaffolding type structure, and it helps give the end of the bones a little more space to work with. The epiphyseal plates, I should say, or growth plates, are at the end of the epiphysis, and this is where the bone growth normally occurs. The epiphysis is covered with articular cartilage, and we haven't really talked about cartilage yet. It's attached by ligaments to the epiphysis of another bone, forming a joint. Articular cartilage reduces the stress of weight bearing and the friction of movement. The thickness of the cartilage depends largely on the amount of stress placed on a particular joint. So you have other types of bones as well. You have flat bones, which are found in areas like the sternum that you see up here, also found in the wings of the pelvis. Irregular bones, as you can see up here, which would be an example of the vertebrae, which has all these different little protrusions and pockets for different functions. Short bones are found in areas like the wrist and the ankle, and sometimes they're referred to as cuboidal bones, and they allow for different and varying amounts of movement or degrees of movement in a particular joint. And then you have what's called sesamoid bones. Sesamoid bones act as pulleys or give a lot of extra strength and leverage to joints that require a lot of strength to get the work done. And a perfect example of that would be the patella, otherwise known as the kneecap. So now compact bone is made up of structural units called osteons, and these are composed of osteocytes and a calcified matrix. The nutrient frame are small passageways that contain blood vessels that supply the osteocytes, or the bone cells. So the word for bone cell would be osteocytes. Between the periosteum, which is the outer covering of the bone, and the endosteum, the inner lining of the bone, you have what's called osteoblasts and osteoclasts, which continually remodel the bones, making them strong, durable, and able to heal. The osteoblasts are bone-forming tissues which help build up bone, and the osteoclasts break down bone in a process called resorption. And you say, why would you want to break down your bone? Well, sometimes bone gets worn out, the cells are not as functional, and so we want to break it down and release the calcium storage for the calcium processes that we talked about earlier before. So because bones have a very good blood supply, they easily heal after trauma or fracture. Spongy bone is less dense, as we said, than compact bone and has a network of open spaces that contains the red bone marrow, which produces the red blood cells. So bones are connected to each other at junctions known as joints. Not a joint that you hang out in, not a joint that you smoke, but rather anatomically, these are called articulations. The range through which a joint can extend and flex is called range of motion, or ROM. So you might hear that term sometime in the future. Joints can be classified by their ROM and include the following. They include synarthroses, which are immovable or no range of motion joints held together by fibrous cartilaginous tissue. An example would be the suture line of the skull. You have many bones that make up the skull, and anywhere where a bone articulates or comes together is considered a joint. But the bones of the skull, at least in adulthood, don't move. You have an amphiarthrosis, which allows for limited range of motion, and these are joined together by cartilage that is slightly movable. An example of these joints would include the vertebrae or the pubic bones of the pelvic girdle, which should allow some little flexible movement, but not a wide range of movement. And then you have diarthrotic joints, or diarthroses, or these are called synovial joints because they're secreted by synovial fluid, and these allow for a full range of motion, including the hinge joints of the knee, which allow for one plane of direction, like the hinge of a door, and the ball and socket joint of the hip, or the shoulder. As a rule, the more movable a joint is, the more prone it is to injury. That's why it's much more easy to dislocate a shoulder than it is an elbow. It's almost impossible to dislocate a pelvis. Almost. Nothing's ever impossible in medicine, however. So as we move on, we want to talk about the different types of muscle tissue that we have in existence. So when we talk about muscle tissue, there's 3 types of muscle tissue that you would learn about in any anatomy and physiology course. There's cardiac muscle, skeletal muscle, and smooth muscle. As we might have mentioned, or we will mention in upcoming lectures, that cardiac muscle is found only in the heart, nowhere else. And it has a special property because it can actually contract on its own without a signal from the nervous system. So it's considered involuntary. Skeletal and smooth muscle also need stimulation by the nervous system to contract. Smooth muscle is found primarily in the lining of your hollow organs. It helps squeeze things through within and throughout the body. Whereas skeletal muscle is primarily involuntary. However, there is some, did I say involuntary? It's primarily voluntary. However, there can be some involuntary actions to it as well, such as when the diaphragm opens and contracts to allow for breathing. The diaphragm itself is considered skeletal muscle. Or when your body temperature drops to an unsustainable level, then skeletal muscle contraction becomes involuntary in the process of shivering. So for our purposes in this lecture, we're going to focus mostly on skeletal muscle and the functions of the skeletal muscle system. Now, before you freak out looking at this picture, you are not going to be required, as far as this class goes, to memorize all the different muscles found in the body. There's just so many. There's about over 300, I believe, from big muscles like the gluteus and the pectoral muscles, to very, very tiny muscles like the intrinsic muscles of the spine, such as the rotatories. We're not going to get that far into detail. So take a deep breath and relax. You can worry about this if you ever take Anatomy 301 and 302. That's when they get more in depth in this. So now what I find pretty interesting as a practitioner myself is the physiology of the muscular system, or how muscle cells actually work in conjunction with the nervous system. So before a skeletal muscle can contract, it has to be stimulated by an impulse that comes from the brain or spinal cord. This impulse moves away from the brain towards the muscle via a nerve cell called a motor neuron. The point of contact between the nerve ending and the muscle fiber is called a neuromuscular junction, a type of synapse. A synapse is communication via chemical messengers. At the synapse, there is a very small gap called a synaptic cleft, and you can see in that picture there's a very tiny space between the nerve and the muscle plate itself. Chemical messengers called neurotransmitters are released by the neuron in response to the nerve impulse. So neurotransmitters such as acetylcholine, which is one of the more common ones, must travel across the synaptic cleft to continue the stimulus and generate a muscle contraction. The released acetylcholine triggers a change in the permeability of the individual muscle fiber. Once that muscle fiber becomes more permeable, sodium ions flow into the fibers, causing calcium to be released from their storage area in the muscle fiber. When calcium is released, the thin actin fibers slide between the thick myosin fibers, causing the muscle to shorten or contract. That's why calcium is so much more important than just to make up the bones and the teeth. Muscles need calcium and energy in the form of ATP, adenosine triphosphate, to contract. What's not mentioned in the book is muscles also need ATP and energy to release as well. If muscles do not have that ability, they will stay in a contracted state. The muscle will relax once the acetylcholine is inactivated and the calcium ions are back in their storage areas of the muscle. But that again is something that also requires energy. And that's a reason why rigor mortis occurs when somebody becomes deceased. Because as living processes, as homeostasis and metabolism stops, you have muscles that are in a state of semi-contraction that do not have energy reserves to uncontract. Is that a word? Uncontract? And that's why you have that stiffening and rigiding of the joints when somebody has passed on. If anybody wants to remind me next week in class or next time we meet, I will tell you a very gory, not gory, but very, I think funny and inappropriate, but I was a young kid at the time, example of how that works during my time in the field as a paramedic. Well, let's get back to serious business now. So even when we're not actively moving, our muscles are in a constant state of partial contraction called muscle tone. This is why your skeletal muscle system accounts for most of the metabolic output of the human body, most of the energy needs, and most of the heat production. Nerve impulses help maintain muscle tone so that muscles are ready to act when needed. Muscle tone is an important factor in proper posture too. Two types of muscle contractions that the body most frequently uses are isotonic, muscle contraction that usually produces movement at a joint. The muscle usually shortens and thickens as the task is done, include walking, running, lifting weight, and twisting. Isometric muscle contraction usually does not produce movement. There's no change in muscle length, but there's an increase in muscle tension. Examples include pushing against a movable object, pushing against a wall, doing planks. There's no movement, but there's an increase in muscle tension. So now I'm going to move on and talk about some common disorders of the musculoskeletal system. The skeleton muscles and joints work together as a functional unit to move the body. Diseases of the musculoskeletal system often affect the ability to move with ease. Common signs and symptoms of musculoskeletal disorders include inflammation. Remember the signs of inflammation: redness, pain, swelling, and warmth, or just plain swelling in the joints, muscles, or bones. A condition called malaise, which is general weakness or discomfort. Sometimes like when you're starting to get a flu, you feel very, very weak before the onset of other symptoms. Myalgia, I should say, which is pain in the muscle itself. Again, something we commonly experience when we get a severe viral illness. Myositis, inflammation of the muscle, and muscle tenderness, and sometimes temporary loss of function or loss of normal mobility. So, probably the most common type of abnormality in the musculoskeletal system would be a typical bone fracture. Now, what's the difference between a broken bone and a fractured bone? There really isn't. A fracture is a broken bone. A simple fracture means that the bone does not break through the skin, whereas an open fracture means it does break through the skin. Sometimes open fractures are referred to as compound fractures. That's not so much an accurate term. And obviously, a fracture that breaks through the skin is more complicated because now you have the problems with blood loss and infection as well. Fractures can usually occur from trauma, overuse, or sometimes disease. A pathologic fracture or a spontaneous fracture results from an underlying disease such as osteoporosis or cancer. Signs and symptoms of fractures usually include the following: pain, swelling, bruising, numbness or tingling, deformity and difficulty using or inability to use a joint. So let's look at some of the more common type of fractures that you see there. The first one you see is called a green stick fracture. It's usually caused by compression or angulation forces, and it usually occurs more commonly in children under 10 because the bones are more soft as we are younger, and they tend to break rather than, they tend to bend more than break. So you see how there's more of a crack on one end, but the diaphysis is intact on the other end. Just as if you were to pull a branch of a stick apart, you would see some splintering on one side, but the other side would stay intact. Whereas something like a transverse fracture is a break caused by a direct force applied perpendicular at a 90-degree angle, so the fracture runs across the bone. A comminuted fracture is almost a shattering of the bone. It's a bone broken in several different places, with multiple fragments. And this actually happened to my best friend in high school growing up, going up for a jump shot in basketball, taking a rebound, and kid twice the size of him landing on top of him. When he landed on the pavement, we just heard crack, 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 and his tibia and fibula were shattered in several places. This had to be fixed surgically with the insertion of metal plates and pins that needed to stay in place for almost 2 years before they were taken out. As you can see, a spiral fracture is caused by a twisting or rotary force, which results in a long, sharp, pointed bone ends. Sometimes can be suspicious for child abuse. When a caregiver or an abuser grabs an extremity with a violent twisting force, but it can also be common in some sports such as gymnastics and skiing, and sometimes even football as well. There are other types of fractures we'll talk about as well, but these are pretty much the most common. Osteomalacia is a softening of bones due to lack of vitamin D. Vitamin D helps the body absorb calcium. In the northern hemisphere, there tends to be a lot of vitamin D deficiency. At least that's what the medical literature says. Calcium, we know, is needed for strong bones. Osteomalacia occurs in adults and children, but in children, the disease is called rickets, and sometimes can be also a sign of abuse and neglect. Osteomalacia and rickets are caused by lack of vitamin D, which could be related to an absorption issue, such as gastric bypass surgery, or lack of dietary intake. Osteomalacia can also be related to kidney failure, liver diseases, and certain medications such as anticonvulsants or anti-seizure medications. Signs and symptoms would include bone fractures without related injuries, muscle weakness, widespread bone pain, usually in the area of the hips. If a provider suspects this to be happening, they'll order blood tests to check for vitamin D levels, along with creatinine, which measures kidney functions, calcium levels, electrolytes such as sodium, potassium, other chemicals like alk phos, phosphate, and parathyroid hormone levels. We'll talk about parathyroid hormones and how that's important in bone development when we talk about endocrinology. X-rays, bone density tests, and sometimes a bone biopsy may be done as well. Treatment usually involves supplementation of vitamin D, calcium, and phosphorus. However, the best way to get vitamin D is through sun exposure. Oral vitamin D supplements are very poorly absorbed and poorly metabolized. Vitamin D production usually occurs most efficiently through sun exposure. But then you got to weigh the pros and the benefits versus too much versus too little sun exposure. Osteoporosis is a condition that causes bones to become brittle and weak. Healthy bone is constantly being broken down and remodeled. When a person has osteoporosis, however, bones are being broken down more quickly than new bone can be created. This leads to weak bones that are easily fractured, especially in the wrist, hip, and spine. So, peak bone mass is reached during a person's 20s and can be maximized with exercise and resistance training and weight-bearing exercises. As people age, bone mass is a lot faster than it can be produced. It's lost a lot faster, leading to osteoporosis. Increased risks for osteoporosis include menopause, family history, small body frame, white or Asian descent, hormonal imbalance, dietary deficiencies, long-term corticosteroid use, so people who are on prednisone for things like asthma or autoimmune diseases can also have an effect on osteoporosis. Sedentary lifestyle, tobacco use, and excessive alcohol consumption can also be at risk for osteoporosis. A bone density test, otherwise known as a DEXA, is the only diagnostic tool for osteoporosis. The low-level X-ray determines the mineral content of the bone, and treatment usually includes things such as weight-bearing exercises to maintain bone density, modifying risk factors to prevent falls, such as maybe through physical therapy, appropriate calcium and vitamin D intake from food or supplements, and there are some medications that are not without controversy, such as biphosphonates, which has been shown to cause some adverse effects as well as therapeutic effects, such as necrosis or wearing away of the bone of the jaw, and hormone replacement therapy, but that has risks as well. Osteoporosis is a chronic condition, but it can be managed, but it does progress with age. And as you can see in this diagram here, you can compare and contrast what healthy bones versus osteoporotic bones would look like. A person with a healthy bone structure usually has normal-sized vertebrae, good joint structure, a lot of dense calcium packed into the bones, where someone with osteoporotic bones usually has weakened vertebrae, leading to compression fractures, weakness within the joints, especially in the hip. If you see this area right here that says femoral head, well, a little narrow area behind the femoral head is called the femoral neck, which is usually the first to go when bone loss is severe, and is the most common cause of hip fractures. Back pain is one of the most common complaints that is found in medicine, whether it be primary care, urgent care, or emergency care. Back pain can usually be described as either mechanical or further pathological. Mechanical low back pain is one of the most common patient complaints expressed to emergency physicians in the United States. It accounts for more than 6 million cases annually. Approximately 2/3 of adults are affected in some way, shape, or form by mechanical low back pain at some point in their lives, making it one of the most common complaints and most expensive complaints to address in medicine. And some causes are a little more serious and a little more worrisome than others. So most times low back pain usually occurs from overstretched or weakened low back muscles in what's called the lumbar area. Before we discuss the lumbar area, hopefully go back and review the anatomy and the physiology of the musculoskeletal system. The back has 5 sections: the cervical area, which is the neck; the thoracic area, which is the upper chest; the lumbar, which is the lower back; and then the sacral and coccygeal area of the spine, which usually don't cause too much problems unless there's some more pathological issues going on. But what are some other things that can cause low back pain? Well, osteoarthritis, for one, wearing away of the bone density, which can cause compression fractures of the vertebrae; bulging and rupturing of discs. We'll talk about that in a few moments. So in between each vertebrae are cartilaginous structures that cause a shock absorber type mechanism to reduce stress and wear and tear. Spinal stenosis is a narrowing of the canal where the spinal cord goes through in the spinal column, which can cause squeezing of the spinal cord or squeezing of the nerves that come out of the spinal cord, causing severe pain. And some issues with low back pain have to do with abnormal curvature. The spine has normal curves. Abnormal curvature of the spine deprives the body of important features related to spinal strength, balance, and posture. 3 most common curvatures are what's called lordosis, which is sway back; an exaggerated forward curve in the lumbar region, which makes the buttocks appear larger; kyphosis, which is sometimes referred to as a hunchback, which is an exaggerated curve in the thoracic region; or scoliosis, which is an abnormal side-to-side curvature that could be in both the thoracic and the lumbar regions of the back. Lordosis is usually caused by genetic and congenital conditions such as muscular dystrophy or spondylolisthesis. Kyphosis can occur at any age, usually more commonly in adults of higher years as a result of degenerative disease of the spine, fractures, and injury. Kyphosis can also be caused by things like Paget's disease, muscular dystrophy, and tumors. Many times scoliosis occurs in children from age 10 to early teens, and the cause is generally unknown. Abnormalities in any of the spinal curves can cause pain, fatigue, and lower back pain in the legs. So usually the provider will perform a physical exam of the spine and a neurologic exam. A spinal x-ray, a magnetic resonance imaging, and CAT scan can also be used as diagnostic tools. Treatment really depends on the severity of the curve and the patient's age and condition. Common treatments would include physical therapy, medications, such as analgesics, non-steroidal anti-inflammatories, steroids, muscle relaxants. Sometimes surgical interventions such as spinal fusion and rods and pins may also be utilized to correct these situations. So the spine is made up of vertebrae. Soft discs filled with jelly-like substances are between the vertebrae to cushion and keep them in place. A herniated or slip disc occurs when it moves out of place. The disc can also rupture, causing the jelly-like center to break out, irritating local nerves. The disc can degenerate with age. Middle-aged and older men are more at risk for a herniated disc, although it can occur at any time. Typically, herniation occurs with strenuous activities, but can also occur with lifting heavy objects, obesity, repetitive movements involving the lower back, long periods of sitting or standing, inactivity, and smoking. Signs and symptoms of lower back herniated disc include sciatica, which you may be familiar with, which is pain and numbness from the hip down to the foot, back pain and weakness. A herniated disc in the neck may cause pain and numbness from the shoulder down to the fingers. Pain usually starts slowly and gets worse and worse with standing and sitting. The plantar fascia is a tough fibrous tissue that connects the toes to the heel on the bottom of the feet, creating the arch of the foot. Plantar fasciitis occurs when the plantar fascia becomes inflamed or swollen from being overstretched or overused. Plantar fasciitis is one of the most common foot complaints. People with flat feet or high arches are at high risk for plantar fasciitis. A lot of athletes suffer problems from plantar fasciitis. Some other risk factors can include running long distances, obesity, wearing improperly fitting shoes. The signs and symptoms usually include foot pain, which is usually worse in the morning and tends to loosen up a little bit after standing or during the day activity. Pain usually is on the bottom of the foot, along the sole of the foot, usually right with the insert between the ball of the foot and the heel. Sometimes a patient will notice mild swelling, redness as well, or even stiffness. We talked about fractures a little moment ago. Different from a fracture is a dislocation and sometimes a subluxation. Um, what is a dislocation? A dislocation occurs when the bone has been completely displaced from the joint where it's meant to be, such as a shoulder dislocation. A subluxation is a partial or incomplete dislocation of the joint. The most common sites of joint dislocations in children is the elbow, where in the adult it's the shoulder. Usually from the elbow, it's from being pulled too quickly or too forcefully by an adult. In adults, it's usually a result of either genetic predisposition or usually from sports injuries. Dislocated joint is an emergency. It requires immobilization and application of cold pack as first aid. Sometimes these can be addressed in a physician's office if there's x-ray available and a physician who's competent in taking care of these situations. Sometimes it has to be referred to the emergency room. Sometimes these conditions are so severe that they cannot be put in place unless the patient is on general anesthesia in the OR. It really depends on how strong those muscles are contracting and what the patient's anatomy is structured as. A blind shoulder relocation should never be attempted in any medical office without the benefits of pre and post procedure imaging, regardless of what they may see on TV. So arthritis is a term that refers to any inflammatory joint condition. More than 54 million Americans have some form of arthritis. It's the leading cause of work disabilities in the United States. About 50% of arthritic cases are in those 65 years or older, though arthritis can occur at any age. It's not just a disease of the elderly. According to the Arthritis Foundation, there's over 100 different types of arthritis. Surprisingly, diseases such as fibromyalgia and carpal tunnel syndromes are considered types of arthritis, although they're not really arthritis. Arthritis can be caused by autoimmunity, infection, injury, and genetic conditions. There are so many different types of arthritis, it would really be beyond the scope of this presentation to get into all of them. But the two general types of arthritis that we'd want to focus on would be osteoarthritis and rheumatoid arthritis. So osteoarthritis usually is involved with just a general mechanical wear and tear of the joints, where rheumatoid arthritis usually involves more of an inflammatory condition or an autoimmune condition where the body makes antibodies that not only attacks foreign pathogens but attacks itself as well. I'll get more about that a little bit later. I'm sure many people have heard the term carpal tunnel syndrome. Carpal tunnel syndrome occurs when there's a narrowing in the bones that make up the wrist, which squeezes the nerves to the hand and puts pressure and inflammation on those nerves, usually the median nerve, as it becomes compressed at the wrist. The carpal tunnel is a narrow passageway located on the palm side of the wrist surrounded by bones and ligaments. This tunnel protects the median nerve to the hand and the 9 tendons that bend the fingers. The cause of carpal tunnel syndrome usually involves repetitive motions, trauma, injury, and conditions such as thyroid disease and rheumatoid arthritis. Women are usually more likely than men to have carpal tunnel syndrome. There are various signs and symptoms, such as gradual tingling, burning, numbness to the thumb and fingers. There are some specific tests that the physician will do on physical exam to check for the suspicion of carpal tunnel syndrome. Usually the initial treatment is conservative with splints, non-steroidal anti-inflammatories, modification of activity. As the disease progresses, sometimes referral to orthopedics for steroid injections, and then ultimately surgical intervention is required. Fibromyalgia is a very poorly understood condition which causes muscle pain, fatigue, and tender points on the legs, hips, backs, arms, shoulders, and neck. It's estimated about 10 million people in the United States have fibromyalgia. Women develop fibromyalgia more often than men and usually occurs after 50. The etiology or cause is unknown. Research indicates that trauma, infection, or injury may change how the central nervous system responds to pain, leading to chronic pain that doesn't have much of an objective etiology. The signs and symptoms of fibromyalgia include widespread muscle pain, burning, aching, stiffing, and soreness. Additional symptoms can include fatigue, sleep disturbances, psychological, mood and concentration problems, anxiety, headache, just to name a few. The provider will perform an examination to rule out other conditions. With no diagnostic tests for fibromyalgia, the provider usually uses a checklist of signs and symptoms, what's called a severity score, and then we'll base treatment based on that criteria. Sometimes medications such as antidepressants, anticonvulsants, biofeedback, and acupuncture have all been used to partially, if not semi-partially, treat the symptoms of fibromyalgia. If anybody's ever known someone with gout, you know it's a very painful condition, also called gouty arthritis. It's a very common form of arthritis. It can occur anywhere in the body, but usually most commonly occurs in the big toe. Can affect the knee, elbow, wrist, or fingers. Can be acute or chronic. Attacks are usually longer and worse as it progresses. The cause is buildup of uric acid in the body. Uric acid results from the breakdown of purines in foods such as liver, dried peas, beans, anchovies. The risk factors for gout include being male, family history, obesity, drinking alcohol, and eating too much purine-rich foods like organ meats and types of beans that we had just mentioned. Certain medications such as water pills, aspirin, and some blood pressure medications can increase the risk of gout. As you can see here, the signs and symptoms of gout include swollen, red, warm, stiff, very, very painful joint as well. Most providers diagnose it on physical exams. Some will order an x-ray. Some will order a uric acid level from the blood, which is relatively useless. The real definitive method to diagnose an acute gout attack is for a provider who's trained in this technique to anesthetize and stick a needle within the joint, pull out the fluid, and examine that fluid under a microscope to see if there are actually uric acid crystals present. Treatment usually includes non-steroidal anti-inflammatories, corticosteroids. There are some other gout-specific medications. Some people need to be treated over a long period of time to prevent gout attacks. A very common medication would be allopurinol. These medications, or these chronic joint gout medications, should not be just saved and taken during the time of an acute attack because it can actually worsen the onset of gout. It's not listed here, but juvenile arthritis is a generic phase for autoimmune, inflammatory, or rheumatic conditions that affect children under 16 years of age. Juvenile idiopathic arthritis is the most common form of juvenile arthritis. There are other types as well. There's no known cause for juvenile arthritis. For some types of JA, as we'll say, there may be some genetic predisposition. Signs and symptoms of juvenile arthritis depend on the specific condition. Most JA conditions cause pain, swelling, redness, warmth in the joints. Some juvenile arthritis conditions may also cause issues with the eyes, muscles, digestive systems, and the skin. So when the provider suspects this, they'll perform an examination or the lab work, though there's no specific blood test. It's really a constellation of signs and symptoms. The goal of the treatment is to provide the child with the best quality of life, so pain control, anti-inflammatories are important, as well as physical therapy and nutrition therapy, as well as social therapy as well. We all know a little bit about Lyme disease. It's the most common tick-borne infection in the United States. It's a bacterial infection that can have a whole host of presentations. Very commonly we think of Lyme disease. We think of the bullseye rash that occurs with Lyme disease, but the flu-like symptoms that can occur with Lyme disease. But Lyme disease can be responsible for uniarticular or one-sided painful arthritic conditions, which we call Lyme arthritis. If it's left untreated, it can cause severe and permanent destruction of the joint. The provider has to have a high index of suspicion to really think about if this is Lyme or not. There are tests that can be ordered. They're very non-specific, but this can actually be cured if it's caught early enough with a high degree or prolonged course of oral antibiotics. That's something that the physician really needs to be on top of and look for. So as I mentioned a little bit before, the most common types of arthritis I would really like you to be more familiar with is rheumatoid versus osteoarthritis. In rheumatoid arthritis, you have swollen, inflamed synovial membranes. Synovial membranes are areas that secrete synovial fluid for joint lubrication. Involves erosion of the bone. It's an autoimmune disease. It usually occurs in both joints together, or what we say symmetrical, as opposed to osteoarthritis, which is the loss of articular cartilage, which usually occurs from long-term wear and tear. So it's a degenerative disease, and it's asymmetrical, usually. You can never say always. Symptoms are very similar. In rheumatoid arthritis, pain, stiffness, and inflammation. Morning stiffness is usually lasts about 30 minutes. Uh, Usually with rheumatoid arthritis, the pain and the stiffness gets better as the day goes by. So the mornings are the worst. It's just the opposite with osteoarthritis. Pain and stiffness with movement, and it usually gets worse as the day goes by and relieved with rest. Some other injuries to be familiar with in the musculoskeletal system are muscular injuries and ligamentous injuries. Remember, muscles are what lets the skeleton contract. Tendons connect muscles to bones. Ligaments connect bones to bones. So a sprain is a very common injury that occurs. I'm sure everybody in this classroom has probably had one at some point in time. Usually the ankle is the most common location for a sprain. And it's an overextending or tearing of ligaments that hold the joint together. A strain is an overextending or tearing of the muscles or tendons, and it can present very similarly. Low back, hamstring muscles are areas where this commonly occurs, sometimes in areas of the foot, shoulder, upper arm. The treatment is generally the initial treatment is generally the same for both of them, usually involving first stopping all activity or unnecessary activity, rest. For the initial injury, cold therapy or ice, compression with a splint or an ACE bandage, and elevation to reduce swelling, or what we call RICE therapy, R-I-C-E, RICE therapy. You may see that on a quiz somewhere, so just keep that in mind. If anybody has ever suffered from a muscle spasm, they realize it can be a very painful condition. It can be brought on by a very sudden, strenuous, high velocity, low amplitude force to the muscle, or it can just occur spontaneously, or it can occur due to electrolyte imbalances like muscle cramps. What happens is this intrinsic muscles, or the smaller muscles of the body, very quickly go into rapid episodes of contraction or tetany, which causes contraction and pain and compression to nerves in the area, and is very painful to relieve. Usually treatment includes rest, ice, analgesics such as non-steroidal anti-inflammatories. Very often providers will prescribe medications called muscle relaxants to these conditions. Some common muscle relaxants include Flexeril, Robaxin, Skilaxin. These are just a few off the top of my head. None of them have been very effective or been proven to really do much of anything except make a person sleepy. But it's just something for you to know in the back of your head. Usually the best treatment for muscle spasms is to gently stretch the muscle, relieve the pain, and have them follow up with orthopedics or physical therapy. So in the field of orthopedics, it's generally the medical assistant's job to assist with the examination of a patient with either an orthopedic or a rheumatologic complaint. So when a medical assistant gathers a medical history on a patient with a musculoskeletal concern, it's important to ask about the symptoms, their onset, what reduces or increases the symptoms, in addition to assessing the pain level. The medical assistant can also ask the patient to rate the pain using a 0 to 10 pain scale. 0 would be no pain and 10 would be the worst pain ever. Another payment assessment tool is the Long-Baker-Facey's pain rating scale, which is described in Chapter 15. Medical assistants should explain the scale to the patients, and then patients can state how they feel. The scale works pretty well for children. The healthcare facility may also require a functional assessment to be done, which gathers information on the patient's mobility and ability to do activities of daily living, such as going to the bathroom, dressing themselves, and eating. So, after greeting the patient, it's important to assist the patient to a comfortable position, offer a pillow or folded blanket. For recent injuries afforded by providers, apply a cold application to the injured area. Procedure will be discussed later in the chapter. Patients may have limited mobility because of the pain. The medical assistant may need to help patients change into the examination gown. Make sure the patient is warm enough by offering an additional sheet of blanket. Explain clearly what's happening and what the patient can expect. During the exam, the provider may use inspection, palpation, range of motion testing, and muscle testing to examine the major skeletal muscles and joints. Many times, the unaffected side is examined first compared to the affected side. So the provider may compare the size, position, and strength of the extremities. Depending on the concern, the provider may also perform a gait analysis, which means the provider observes the gait of the patient walking. Gait abnormalities may be the cause or the result of different musculoskeletal conditions. The medical assistant assists with diagnostic procedures by scheduling and preparing patients for procedures. If tests require restrictions of foods or fluids, the medical assistant should address the following points with the patient after talking with the provider. Question is, can the patient have water prior to the test? Which medication should the patient take prior to the test? Or when can the patient resume the current medications? Well, let's talk about some of the more common diagnostic procedures for musculoskeletal conditions, a description of the procedure, and some of the things the medical assistant should do to help the patient prepare for these examinations. First would be an arthrogram, which provides a visualization of the soft tissues in the joint, such as the tendons, ligaments, and cartilage. It's a series of x-rays are taken of a joint after a contrast medium, such as a dye, is injected directly into the joint. Not that common these days, but still may be used. It's important to screen for pregnancy, anticoagulant use, and an allergy to the contrast medium, which is usually iodine-based, or other medications. Make sure the patient understands the procedure and signs a consent form. Let the patient know that they may feel a sting when the medication is given. After the test, there may be some mild pain and swelling in the joint area. Ice and analgesics are usually appropriate. A bone scan is an imaging test used to diagnose bone disease, tumor, or cancer. Small amount of radioactive tracers injected into the vein and it collects in the bones and organs. A camera slowly scans the body and takes pictures of the radio tracer that collects in the bones. Again, just like any invasive procedure that requires the ingestion or intake of certain types of tracers, screen for pregnancy. Patients should not take any medication such as Pepto-Bismol for at least 4 days before the test. Have the patient remove all metal items such as jewelry. Small amount of pain is felt when the needle is inserted, but the scan itself is generally painless. Depending on the condition, an initial scan may be done as a radio tracer is injected, and then 3 or 4 hours after the radio tracer has collected into the bone. Computed tomography, or most commonly referred to as CT or CAT scan, is used to detect fractures, tumors, and other abnormalities. This imaging test takes cross-sectional pictures of the body and puts them together in slices. Contrast medium may or may not be used. And again, anything regarding radiation, screen for pregnancy and allergy to contrast medium if it's indicated. Patients should not eat or drink 4 to 6 hours prior to the test if a contrast medium is used unless it's an emergency. Have the patient remove all metal items or jewelry and put on a gown. When a contrast medium is given, the patient may feel some burning or flushing May get a metallic taste in their mouth. It's important to let them know that that's normal and to be expected. A dual energy X-ray absorptiometry or DEXA scan is a bone density test used to measure the calcium and other minerals in the bone. Central DEXA requires a scanner to pass over the spine and hip. Peripheral DEXA measures the bone density in the wrist, fingers, legs, or heels. Once again, screen for pregnancy. Patients should not take calcium supplements for 24 hours before the test. Have the patients remove all jewelry and other items. The test is generally painless. Results are reported as something called a T-score, which compares the bone density to that of a healthy woman, and a Z-score compares the bone density to other people of the same age, gender, and race. EMG, electromyography, checks the nerves and muscles. A thin needle electrodes are inserted through the skin into the muscle and picks up the electrical activity in the muscle, kind of like when an electrician uses a diode or diode. I don't know what they're called. Not too much to go for. Screen for anticoagulant use because the insertion of needles can cause excessive bleeding, but no other real special preparation is needed. Person may feel little pain when the needles are inserted. The site may be tender or bruised for a few days, but that's generally the biggest problem with this procedure. There are some medical laboratory tests to test for musculoskeletal conditions. Most of them are usually sent out, but some of them can be performed in-house as CLIA wave tests, such as which would be a C-reactive protein, which checks for a non-specific indicator of inflammation. The next would be an erythrocyte sedimentation rate. This measures how quickly red blood cells in a blood sample settle to the bottom of a test tube. The quicker they settle, the more it indicates inflammation in the body. Again, very non-specific. The provider may order Lyme disease titers. Obviously, if it's in blood or cerebral spinal fluid, it's generally not going to be done in the office. Rheumatoid factor can also look for if the patient has been exposed to certain rheumatoid-causing diseases, such as streptococcus infection. Can also look for vitamin D and parathyroid hormone. Often, orthopedic injuries severely affect the normal ROM, or range of motion, of a joint. Measuring the range of motion of specific joints is an objective measure of both the seriousness of an injury and the recovery progress. The joint may be evaluated with active and passive range of motion. To determine the active range of motion, the patient is asked to move the joint as far as possible. For evaluation of passive range of motion, the provider moves the joint as far as possible. A device called a goniometer is the most common tool used to measure range of motion of a joint. They have calibration markings to indicate the measurement. A goniometer has two arms that are fixed together with a hinge joint at one end. Each of the arms is lined up with the bone on each side of the joint being tested. The degrees of motion are indicated on a scale on the hinge center of the non-digital instrument or on a digital display of a digital instrument. All range of motions are measured in degrees. Usually pain, tenderness, or crepitation, or feeling of the bone grinding onto itself, is noted during the procedure as well. So as you can see in this procedure, a therapist or a provider is evaluating range of motion using that device, which is a goniometer. You can see it's hinged in the middle and it's calibrated and it indicates a certain amount of range of motion using degrees. During the range of motion evaluation, the provider also assesses each muscle group for strength. Normal muscle strength allows for complete voluntary range of muscle despite resistance. This resistance can be gravity, as when rising from a sitting to a standing position, or physical, as in pulling, pushing, or lifting an object. Muscle strength is bilaterally equal in normal conditions. Hand grip strength can be measured with a dynamometer. Digital and non-digital dynamometers are available. A dynamometer provides an objective measurement of hand grip strength. The patient holds the dynamometer in the hand being tested. Typically, the arm is at the side of the patient with the elbow bent at 90 degrees. Various arm and hand positions may be used for different assessments. Quite often, though, when these tests aren't really observed, muscle strength test is done subjectively using the provider's or the therapist's own hands and physical exam. Patients with orthopedic and rheumatology conditions are often prescribed a variety of medications. The following are just some of the more common classifications of medications for orthopedic and rheumatology specialties. Analgesics are used to relieve pain. Anticonvulsants treat neuromuscular disorders and epilepsy, but they can also treat musculoskeletal pain as well. Anti-gout medications, such as we talked about colchicine, treat gout. Anti-inflammatories treat arthritis and other inflammatory disorders. Corticosteroids, such as prednisone, treat chronic inflammatory diseases. Muscle relaxants, such as we spoke about, such as scalaxin and Flexeril, treat painful muscular conditions, although their effectiveness is questionable. Osteoporosis agents promote bone mineral density and reverse the progression of osteoporosis, although they do come with some controversy as well. Tumor necrosis factor inhibitors treat autoimmune disorders such as rheumatoid arthritis. Splints and casts are applied to immobilize joints and bones after injury or surgery. Splint consists of a strip of rigid material that immobilizes an extremity. Provides partial protection while the site heals. The splint can be adjusted as the swelling changes. Ready-made splints and custom-designed splints are used in the ambulatory care environment. Ready-made splints usually have Velcro straps which assist with taking off or putting on the splints. Custom-designed splints are used with elastic bandages. Casts provide additional protection to the injured area and are usually performed by specialists such as orthopedics. Casts can be made from fiberglass or plaster. Fiberglass casts can be colorful, lightweight, durable, and porous. They do not need to be removed during x-rays. Plaster casts are cheaper and easier to shape. The medical assistant can help the provider apply the cast and the custom-designed splints. Medical assistants can also help remove the cast. We'll go over those in your procedural videos. The medical assistant needs to provide cast care instructions to patients. It's important to teach patients about checking the color, sensation, motion, and temperature, CSMT, of a casted extremity. Color of the extremity in the bed should be pink, not pale or bluish. Normal sensation, there shouldn't be an increase in amount of pain or pins and needles type sensation. Patients should be able to move their toes and fingers normally. If they're unable to move their toes or fingers, that's an emergency. If the extremity becomes cold to the touch, these are all indications where that cast needs to be removed immediately. Cold and hot therapeutic modalities or treatments are used for orthopedic injuries and infections. The applications can be dry or moist. Dry means no moisture is left on the skin. Moist means moisture is left on the skin. Dry applications tend to pull moisture out of the skin. Moist applications tend to increase tissue elasticity and allow heat or cold to penetrate deeply into the tissues. It's very debatable which is better for an acute injury, cold or hot. The general recommendations is for an acute injury, for the first 48 to 72 hours, the application of cold is best to reduce swelling and inflammation. After which, 72 hours and beyond, the application of heat to help stimulate circulation and facilitate healing. However, these recommendations should only be made by the provider and not the medical assistant themselves. We talked about this already, rice therapy, no, not rice soup. For an acute injury, first of all, we rest the extremity. In other words, especially in sporting events, do not play on the injury. Elevate, apply application of ice, although ice should never be directly applied to the skin for fear of causing frostbite. But instead, we want to have ice wrapped up in a towel or a sheet or something to apply a moderate amount of cold to the extremity. Believe it or not, a frozen bag of vegetables works pretty well. Those chemical cold packs are generally useless. Most authorities agree, they just don't get cold enough for a long enough period of time to do any good. Elevation is good, but only if it's done with the extremity above the level of the heart. If the person is sitting in a chair and their ankle is elevated on a table below the heart, it's basically doing nothing. And the use of compression is to help keep swelling from occurring both in and out from around the joint. TENS therapy is very effective for acute muscular pain by introducing limited microelectrical shocks to overstimulate and overcontract the muscle to cause it to relax. These therapies are even being sold over the counter now in many different pharmacies. So here you have a video which you cannot access, but it is in your folder, about assisting patients and instructing on the use of crutches and walkers. We will be covering that and going over that in our next lab session. Proper walker instructions is also important. At least at the initial stages, the medical assistant should be familiar with these devices. More extensive training and patient coaching is usually provided by physical therapists and occupational therapists, but you should be aware of these devices as well. And with that, if you do not have any questions, or if you do have any questions, please email me or post it in the discussion site on Blackboard, and we will reconvene next week. Thank you very much for your time and attention.